Welcome to the webinar, How to Use 42 Online Modules to Improve Communication Skills, sponsored by DocCom, whose mission is to provide engaging educational resources for healthcare professionals to enhance communication and health outcomes. I'm Barbara Lewis. I'm in healthcare because I spent 2 weeks in the ICU with my sister Joan, who passed away quite tragically. And I decided to devote my life to improving the patient experience. I was very fortunate to get a grant to research what medical schools were teaching about the patient experience, and I learned about DocCom. And it's been an honor to work to improve communication skills with DocCom because I can tell you that everything that went wrong in the ICU with my sister had to do with a failure of communication. So here's what we're going to be covering today: the value of communication skills, patient satisfaction surveys, and how they're impacted by communication skills. Then we'll go over the DocCom modules and then talk about how residency programs are using DocCom, how medical schools are, and finally hospitals. So we'll take questions and comments throughout and just put them in the Q&A box, and I'll periodically check that. And a recording will be available on the website. But before we get started, I wanted to have a poll and just find out who you are. So if you could fill out the poll and tell me where you work, and and you can have multiple choice here as well, and how you would describe the major part of your role. And we'll just take a few seconds for you to fill that out, and we will end the poll pretty fast here because I don't want to take up too much time, but I really appreciate it because this will help me customize exactly what I'm going to talk about today if I know who you are. Okay, so here's the results. And it looks like we have medical schools and health systems, okay, and faculty, attending, curriculum. Okay, great. That really helps me a lot. I appreciate it. Okay, so let's get started here. So evidence-based importance of communication skills. Great communication skills improve medical outcomes, decrease malpractice claims, enhance physician and provider satisfaction, and they improve patient satisfaction scores. So the HCAHPS surveys, which are mandated by the US government if a hospital receives Medicare funds, and of course most hospitals do, but analysis demonstrates that the two communication skills are really driving, or the two communication dimensions, I should say, are really driving the overall scores. So this is the Medicare.gov website where you can put in a hospital and then compare it. I'm in Los Angeles, so I compared it to the California average and the national average. And these are the two communication dimensions that are used. And at least 3 organizations have done the analysis on the data and have found that the communication dimensions drive the scores. And this is from CMS, Cleveland Clinic, and Press Ganey as well. And by the way, this red one has been taken out of the HCAHPS dimensions. So DocCom is a proven online interactive healthcare communication skills learning system. It's very interactive, and I will get into that in a little while. In 2003, the Academy of Communication in Healthcare and Drexel University College of Medicine identified a gap in communication learning for medical students. And this was about 24 people who gathered in Kalamazoo to talk about education and specifically identified this gap in communication, and it was known as the Kalamazoo Consensus. And DocCom obtained a grant from the Arthur Vining Davis Foundations. DocCom was launched as a pilot in 2005, became a nonprofit the following year, and we have been offering continuing medical education since 2015, and that's over 40 credits. So what people like about DocCom is that you can view the modules anywhere, anytime. We have about 90 institutions that subscribe, and over 90,000 subscribers have used DocCom in 20 countries, and we have been translated into German, Japanese, and Portuguese. And 9 journal articles talk about the value of DocCom. And here are some of the covers of those publications. And you can find more specific information about each of these studies on our website. So initially we started out with 100% of medical schools subscribing to DocCom, but now our fastest growing programs are residencies and hospitals. And you can see here the 44% is the medical schools, and over here we have 41%, which is the residency program. So residency programs are finding a lot of value in DocCom, and I'm going to talk specifically about one residency program, how they're using DocCom. So here are testimonials, and we have a lot of testimonials on our website in the various areas of hospitals, residency programs, medical schools, and PA programs, both from the faculty and the learner. So you can go to the website and read a lot of these. This last one here talks about remediation, and we're finding that an increasing number of organizations are using DocCom for remediation, and I'm going to get into that in just a moment. So the modules are written by leading faculty. We have 42 media-rich interactive online modules with over 400 videos that are very realistic. And whenever we do surveys, this is what the users love. They love the videos. And then we have annotated interactive videos, which I'll talk about later. And then the back end, we have a learning management system where faculty can make assignments, they can assign assessment questions, there's a grading matrix, there's a ton of resources, and we have curriculum guides too. So we have everything that you need to get DocCom in place and launch it. There's not too much else that needs to be done. It's really a very self-contained program. The 42 modules are divided into 5 sections: basic modules, essential modules, advanced elements, communicating in specific situations, and communicating with colleagues. So let's just take a look at the basic modules. We start off with an overview, and this is a fantastic module with a lot of evidence on why communication skills are so important and the change in outcomes as a result of communication skills. We also have mindfulness and reflection, done by Ron Epstein, and balance and self-care, as well as therapeutic aspects of medical encounters. Now, when we move into the essential elements, these 8 modules are most closely mirrored to the HCAP surveys. And this is about starting the interview, the patient-centered interview, building the relationship, getting the information, reaching agreement, etc. Then the advanced levels, we have modules like responding to strong emotions, it goes without saying, nonverbal communication, and others like shared decision-making. In communicating with specific situations, we have things like the family interview, the adolescent, geriatric, tobacco intervention, and communicating difficult news. We also have this one here, communicating with depressed patients, and we've got a webinar coming up on that module, a free webinar in another month or so, and at the end of the presentation here, I will give you the information on how to sign up for that. And finally, we have communicating with colleagues, and this one we have communicating on health teams and the oral presentation, which is another very popular module. So our modules are very consistent. We start with the rationale, key concepts, learning goals, and then videos interspersed, and then we have a behavioral checklist. So when the module launches, out pops the patient talking about why she is coming to the appointment and what she wants to accomplish. Then the physician talks about what his goals are in the appointment. And then there are questions for reflection. And some of our subscribers actually use these questions for reflection as assignments for their learners. And then they discuss them in small groups. We then move to key principles, learning goals, and finally the content, which is heavily cited we oftentimes may have more than 50 references in a module because everything in the modules are evidence-based and they're all updated, and I'll get into that in just a moment. So here is the annotated video, and our learners love this because they can learn 3 ways. So one way is that they can see the body language of Dr. Tim Quill here leaning into the patient and her husband. They can listen to what he's saying. And with our annotated videos, users can actually read the methodology that he's using. So in this case, he's naming the emotion and legitimizing it. So it's 3 ways to learn, and our learners love this. Now, if you click on the icon here that is a camera, then out pops the clinician or the patient. The clinician here is talking about exactly what he's doing. So he's using direct words and attentive listening in this case. So as you go down through all of the techniques that are being used here, the clinician will share information on why he's using it at this particular time and how he's moving the conversation forward or the motivation for what he wants to do. This is one of 6 comprehension scores that we have. And this one is empathy understanding. And it's a very interesting interactive video that we have for learners. So the conversation between the clinician and the patient has no empathic comment in it from the clinician. And what the user does is listens to this, and when they think an empathic comment should be made, they click down here, and then it's scored over here. So this is in Build the Relationship module. And what we're finding is that organizations are using this for remediation before or even after users view DocCom. They take this test, and the organizations are able to identify people who need remediation because they don't necessarily know where an empathic comment should be made. Another comprehension score that we have is facial recognition. So the faces come up, and the user will click on whichever face it is, and they stay up for 5 seconds. And then they're reshuffled, and they come up again for 3 seconds. And then they're reshuffled, and they come up for 1 second, helping the learner to understand very fast a micro expression and what that might mean. And we have 4 other comprehension scores as well. So this is our patient portrait in our substance use disorder module by Barbara Schindler. And these are 5 actual substance users, including a physician, talking about, or answering, I should say, 20-something questions on how they got started, what their life was like, the impact, the quitting, why they quit, was there a relapse. And this helps our learners understand the personal nature of substance use disorder and how it affects people and impacts their lives and those around them. And finally, we come to the checklist here. And this is 17 steps on delivering difficult news. So for an intern who may be relatively new and maybe has not delivered difficult news, this is something that the person can easily pull up and go through these 17 steps and have some background as to exactly what they should be doing in the encounter with the family or the patient regarding delivering difficult news. So this is something that I certainly wish the physicians who were caring for my sister had, and who told me that she was dying, and certainly didn't do it in a way that was appropriate, in my opinion. So each of our modules is revised every 3 years, and of course we always add new content as well. So in January, we identify the modules with the earliest revision date, and we pick about 14 of them that will be updated that year. And then we go through this process, and then finally we will alert the subscribers about the new content and the revisions of the module. So no module is out of date for more than 3 years. So I wanted to take a look at how DocCom is used in 3 settings. 1, a residency program, 2, medical schools, and finally hospitals. And it seems as though we have people in every category who are on now. So how is DocCom used in residency programs? Well, this one particular residency program had a problem. And they noticed that in June orientation, when they assessed the EPAs, that they had to remediate quite a few of their interns. And basically, the problem was around the H&Ps, and they felt that the quality was just not high. They thought that the interns knew what to ask. They were on a checklist, checking off the questions they had to ask, but they didn't know how to ask it. So their solution was DocCom, because it's easy access anywhere, anytime. And initially, the assignment for the modules was made at orientation. But the following year, program director decided to assign the modules after the match in March, when he felt that learners had the time to view the modules and they wanted to impress him. So the following year, he found that there were much better communication skills. And he was telling me this story, and I thought, oh my gosh, let's test this and see what happens. So the following year, that's what we did. We tested it. So right after the match and before they went to orientation, they were assigned the empathy understanding test, which is module 6. This is the one that I had just talked to you about, and selected multiple choice questions from the modules that are most closely aligned with HCAPs. Those are modules 5 through 12. So there was no knowledge of DocCom at this time. We just sent this video that was not related to DocCom in any way and the multiple choice questions. And then after we got the results back and everything was ready to go, the program director assigned the modules, which are each about an hour in length, to the interns to view before orientation. So he assigned 27 modules, and that equated to approximately 2 per week, which he thought was very doable. So they came in orientation, and wow, there were far fewer remediation candidates and a real improvement in the scores. And here's what that looked like. So in the empathy understanding test, before DocCom, only 41% correct answers. And after DocCom was viewed, 96%. And then we did the delta in the before and after of the multiple choice questions, and we found that it averaged around 30, high 30s with the difference between the two. And these two down here, these two particular people, they scored very high on the pre-DocCom. So that's why their delta was not as high. But you can see that there's quite a bit of change in the before and after. So now let's move into how medical schools are using DocCom. So in the preclinical curriculum, one school uses 16 modules. And the format is that the students complete the modules totally independently, and they complete the discussion questions as well. And then they participate in facilitated small group activity where they reflect on their personal experience. They watch videos and describe the skills, and they role play. So before COVID, these were, of course, in person, and now they're through Zoom, and the classes can be further divided into breakout rooms if the instructor wants to have a really small group. In the clinical curriculum in medical school, so here's 5 clerkships and the modules that are used within those clerkships. And the format is that, again, complete the modules independently. So DocCom is like a flipped classroom, concept where you learn about the module content outside, and then you come in and talk about it in the group. So the learners answer the module questions for reflection. So here they're taking those reflection questions and answering those. Then they're doing an essay about the questions and their experiences. Then they have some discussion question and MCQs. And finally, they participate in a weekly video conference to discuss each module. So one of our medical schools held a video contest that was extremely successful, and I wanted to share this with you. So the goal was to increase the student engagement. That's what the faculty wanted to do, and they wanted to inspire active learners. So the assignment was that the students picked a module to depict and to film and to video. And then they had this red carpet event where they reviewed all the videos, they showed all the videos, and the faculty voted on the best video. And then they had an award ceremony, and the Oscar goes to. And the purpose was to create this very memorable experience. And the comments that got back were, I love the DocCom group assignment. I love participating in this project. Memorable, a ton of fun. It was a great idea. So the students learned where and when they wanted in general in our medical schools. The DocCom modules promotes the development of independent learning skills, and the curriculum is taught from a patient-centered perspective, and everyone agrees that the scripts are very realistic. Well, actually, they're not scripts. They're unscripted. So we do have grading features which you can use. So here we have the groups, and here are the people, and this is their aggregated score. This is multiple choice scores, video scores. So these are the comprehension score. And then you can also look at each person's scores, and the people will be down here. They've been whited out. These are the modules across. These are color coded. So you can see that the top scores are green and the low scores are red. And you can easily see by this who's doing well, who has done a lot, and perhaps what particular modules might need more reinforcement. So now let's talk about how DocCom is used in hospitals. And this is just an example of one hospital program. First of all, they identified champions who would endorse DocCom and lead the initiative. And then they got their internal statistics of what poor communication was costing the hospital through HCAPs. And I actually talked to 2 hospitals that each left $1 million on the table as a result of their low HCAP scores. And since we know HCAPs, the communication dimensions are driving the HCAPs, and we realize that communication has a lot to do with those scores. So then they use some external statistics as well from DocCom Module 1 and other sources. They monitored everyone's progress. They could see what they were doing. They used coaches to work with physicians, and they tracked before and after DocCom communication scores with HCAPs. And then they asked everyone for their certificate of completion. So CME has some privacy rules, but the certificates were forwarded to the office to keep track of the CME credits. So in motivating the physicians to improve their communication skills, one hospital was thinking of canceling malpractice insurance if their scores didn't improve, and you probably realize that a large number of lawsuits are around communication. I think it's a majority, actually, with insurance companies. And then hospitals requested a plan from low scores on how they would improve their communication skills, offering them DocCom as a resource. There was some payment for individual improvement or team improvement, and oftentimes the teams were put together with low scores and high scores, And the idea was that the high scores would help the low scores and everyone would get paid. And then one hospital is sharing patient satisfaction scores with all the learners to inspire competition. And I think this might be fairly common these days. And then finally, they mandated module completion by a specific date, and they videotaped the physicians with the patients and assessed it in terms of the coaching. So we have a ton of resources, a faculty guide and a syllabi, so there's no reason to reinvent the wheel here. If you want to do a module, and you can, this is module 8, for example, here you can go through a 2-hour program of exactly what you can be doing, the reading, the assignments, the discussion, the role playing, etc. This is our facilitation guide, and of course we have a very comprehensive administration guide for how to logistically get DocCom up and running, although we have a terrific team that will help you if you want to start. So very, very little is left up to you if you want to start with DocCom. So our subscription costs have been called dirt cheap. And somebody also said to me, you can't afford not to subscribe to DocCom. So it's $30 per seat, which means that if you have 100 residents, for example, you could rotate them in and out. So you could do 25 in 1 month or in a quarter, and then rotate them out and do 25 more in the next quarter. And you're only paying for the seat for 1 year. Now, if you have more than 500 people that you want, and we look at this by domain, so it could be a medical school or residency program and a hospital that could get DocCom. And then finally, trial subscriptions are $29.95. However, because you're in this webinar, you can have a free trial subscription and no credit card is required whatsoever. So our upcoming webinar is on module 27, communicating with depressed patients, and that's going to be on Thursday the 3rd at 3 p.m. Eastern Time. And Dr. Dennis Novak, who's the founder of DocCom, Dr. Damara Gutnick, are going to be talking about how to talk with depressed patients, and they're going to be role-playing this as well, so it should be quite interesting. And you can sign up on the bit.ly by putting in depressed patients webinar. So DocCom has a sister platform, and that is professional formation. And I just wanted to bring this up just in case you might be interested in professionalism. We have 13 free modules only during COVID, though. This is going to go to a subscription model as soon as online learning is replaced with in-person. So you see here we're talking about social justice and moral distress, moral courage, confidentiality, and we also have 2 faculty modules, faculty development and remediation, which is coming out soon. If you'd like to sign up for these free modules, again, just go to the bit.ly and put in professional formation sign up, and you will get those free until we are back in person learning. So thank you very much for coming to this webinar. I know we have people from all over the world. And if you would like more information, if you'd like a personal tour where I'll actually go into the modules, if you'd like me to do that, I'm more than happy to. Here's my easy email address right here, and just email me. And also, if you'd like a trial subscription, a free trial subscription, no credit card required, for 30 days, please contact me and I will be more than happy to give you that trial subscription. So thank you to everyone who has joined us today. The recording will be on our website shortly, and I look forward to seeing you on our next webinar. Thank you.